Thanks for staying with us. We're back with physical therapist and author Lisa Chase. Now, before the break, we were talking about healthcare in general as a whole body approach, but now we're going to narrow it and focus on our hearts and how physical therapy can improve our heart health. Thank you so much for sticking around.
Absolutely.
Okay, so let's talk about the heart. When we think about heart health, we often think about exercise, diet, cholesterol.
Yeah, absolutely. Those are important, and those are the common things. But there are other things that can really impact our heart. So let's talk about sleep. So a statistic that many people might not know is that if you are getting under 7 hours of sleep, it doubles your risk of cardiovascular disease.
Guilty.
I know. This is, I see this all the time, right? So just prioritizing your sleep, trying to get that 7-hour window, getting on some kind of a schedule and a routine, you know, not eating too late and allowing your body to get into that deep full rest, because that's when we heal.
Yes.
And that's when our body is regenerating. And so if you're skipping that and you're not able to have that happen, okay, a couple times is okay, but over the years,
consistently,
then what happens is those habits then turn into becoming a problem.
So 7 is our magic number.
Yes,
you see
at least
it, you know,
7.
some people are like, some people are okay with 4 to 5 hours.
I know. No. 4 to 5 hours is not enough.
Okay, 7 hours, so we're aiming for that.
Yes.
What about, you have a technology that you use that is called beamer.
Yes, I'd love to talk about beamer. So beamer is something that I personally use not only in my practice but at home. So beamer is a pulse electromagnetic frequency treatment. So it's a pulse wave that stimulates our microvessels. So we have our veins and we have our arteries, and they come together into those little capillary systems. And that is what drives the blood down to our cells. And what beamer does is it activates, there's a motion we call vasomotion, so it's a pumping motion that pushes that blood down into the cells and makes that exchange. So it gets the toxicity out and gets the good blood in. So this is an 8-minute treatment. You lie on a mat and literally you could feel it starts to pump all of those, you know, little vessels. And so it's great because it's increasing our microcirculation, which our heart needs, that microcirculation. So for some people that might not be able to exercise, this is a great way. For people that are healing, anytime you want to increase that blood flow, it's a fantastic technology to be able to use, and it only takes 8 minutes.
I'm sitting here and I'm picturing how this works, and it makes sense because I'm thinking a little bit of whenever you go to maybe for massage therapy or chiropractor and they use the electro pads that you put on. Is it similar to something like that?
It's different because that's an electrical current, and this is a pulse wave, so it sends a signal that our blood vessels actually recognize, and it makes them pump more. So similar in that, you know, it's getting some kind of activation, but the mechanism is different.
That's a great alternative to, a lot of people can't get out and get physical if you're dealing with an injury.
That's right.
And you have a personal story on what you're doing and you're so passionate about, because you've used this and you know how it works. Yeah,
so this is a great story, and it was a reminder to myself. So about 3 years ago, I went to have my physical, and my physician measured my blood vessels to look at the health of my and the aging. And at the time I was in my 50s, and it was showing that my blood vessels were well into the 60s, and I was like, oh my God, what's going on? So I implemented beamer, doing regular beamer, and then something called blood flow restriction training, and we can talk about that. And the following year I went back and she did the same tests, and now my blood vessels were younger.
Wow.
And I was like, wow, that was amazing. My VO2 max, I mean, everything just improved around my fitness, because blood flow restriction helps to increase the blood flow, you know, to our entire body, and then beamer does as well. So this was helping my heart, it was helping my muscles, it was helping everything.
No, I have to ask, because I'm sure everyone at home is wondering, did you change your diet? Did you add exercise?
I didn't. Nope, I was already exercising, but what I changed was adding blood flow restriction to my exercise. So that is simply, they're little cuffs that you put on your arms and your legs, and it slows the blood flow. So it mimics high intensity exercise without having to do like heavy weights or too much high intensity. It automatically happens because of that slowed blood flow.
Makes sense. You know, We talk about being proactive about your health. This isn't a product we're endorsing. We're just saying that there are other different ways to go out there.
So many different
because
options.
we have so many excuses. We can't do this, or we're told no, not this.
Yes.
But have those conversations with your doctors. Thank you so much for having this conversation with us. I think it's so important.
Thanks
we
for having
appreciate you. And of course, we'll share Lisa's info on our website, bloomtampabay.com. Stay with us. More Bloom after the break.